Hi everyone. First of all, I would like to thank especially the National Program and Technical Enhanced Learning Committee, which is initiated by the IIT and being supported by Human Resources Development, Government of India. Thanks for taking such a good initiative program, and which is going to be helpful for many of the budding dental surgeons, or if some dental surgeons who wants to revive their or update their particular knowledge. And I would like to thank immensely Dr. Jimson, who has taken a lot of pains in doing this, in charting out this particular program and allocating various topics to the experienced maxillofacial surgeons or the dental doctors, so that they can give the insights or they can give an advanced knowledge of this particular topic, and especially for the dental surgeons, budding dental surgeons. My topic today is asthma in dental office. I am Dr. Rajshekar, Dean and Principal, Mamta Institute of Dental Sciences, Hyderabad. Coming to the introduction, asthma is one of the world's most common chronic disease. When I say one of the most common disease, the other most common diseases are hypertension, diabetes, and maybe the thyroid problems. And from the respiratory point of view, definitely asthma is one of the primary, the common chronic diseases in the world. The prevalence is increasing in many countries. It is maybe due to pollution, maybe due to the various factors, and it is morely affecting in children. This is a serious illness in children, mainly seen because there are few factors which are responsible more commonly in children. One is there could be because of premature delivery, which reduces or which the immune system of the child is not very well developed. The second, the lungs are not very well developed. And the third, maybe there is some amount of genetic factor. Fourth, there may be because of active or passive smoking during or after pregnancy of this particular child's mother. And also, very rarely, maybe there may be a passive smoking of the child, probably because of one of the parents who is smoking at home. These are the reasons which are more precisely this particular condition is enhancing in children. And also, added to this, pollution also is one of the factors. And it is not just the respiratory entire system, it is the individual cells and the cellular elements which play a very important role in causing asthma. The healthcare expenditure is increasing because this particular condition is not that it comes and it goes. It takes, it comes on and off. And also you have to spend money on this, and you have to go for the treatment. And this instead of this expenditure putting on asthma, we can as well use for betterment of our health, betterment of our lifestyle and things like that. But because of various reasons, since this condition is occurring, we have to spend on it, which is causing a lot of expenditure for the parents. Coming to a little bit of epidemiology, which is very, very important, because this is important to know how vastly this particular disease is spreading and how important how seriously we have to take this particular condition. And as you all know, there are various days fixed to this particular conditions. Unless until this condition is prevailing in a high manner, the days are not allocated to this particular condition. Example, if you say World AIDS Day, this is falling for the 1st December because the AIDS is one of the most dangerous disease, and thousands and lakhs of people have been affected by this condition. So this 1st of December is allocated to World AIDS Day. Likewise, World Cancer Day is 4th February. So even this particular condition is creating a lot of disturbance, a lot of agony to the individuals. So a day has been 4th February has been allocated. Similarly, World Diabetic Day, 14th November. Likewise, since asthma also is creating a lot of disturbance and lot of trouble, and millions of people are affected worldwide, that's why May 5th of every year has been allocated as World Asthma Day. And as I said before, this is one of the most common chronic disease, and an estimated of 300 million people are affected till date, and this is going to increase to 400 million by 2025. In the means, in the next 3 years, I would say only 3 because we are almost fag end of 2021. So from 22, if you take to 25, it's only 3 years, and in 3 years we are going to have 1 million extra people. 100 million extra people are going to get contracted with this particular disease. So right now we have 300 million. By 25 we'll have 400 million people affecting or getting affected by this particular disease. As per various studies, if you look at various studies, this population of each and individual country, it ranges from 1 to 18% of the population, they have this particular condition. Maybe 1% you can see in the country like Bhutan, where it is carbon-free country. They give their laws on pollution are very, very strict and very stringent. So there the pollution levels are less, and it's a carbon-free country with a lot of greenery around. Probably there is only 1% of the population gets affected with this particular asthma. But whereas other third world countries, where the developing countries, maybe the percentage is much more, close to 18% of their population is getting affected with this particular condition called asthma. So you should know how important it is about knowing about this condition, treating about this condition, or you want to treat any other aspects when the patient is having asthma, or when the patient had an asthmatic attack and now you are taking and doing some other treatment for this. So you cannot take this condition very easily, so you have to be very, very clear. So what precautions you take when you deal with this sort of patients. Annually about 250,000 people are dying because of this condition, with so much of advancement of medication, so much of advancement of many other aspects of the equipment or the healthcare system and things like that, but still we are losing 2.5 lakh people every year is not something very small. So the incidence of this particular asthma is increasing in even the developed countries, maybe because wherever the pollution levels are increasing, their asthma is increasing. So keeping in mind this, every one of us have to be little generous towards green revolution, to know about this particular disease in detail, so that when we are treating, when we are doing some things like that, so we'll be more aware and more clear how to tackle and how to tackle this condition and how to do our treatment modalities when there is asthma to this particular patient. Coming to the definition of asthma is a heterogeneous. When I say heterogeneous, it's a divergent disease and multifactorial. There are multiple factors for this disease, and variable. It is not constant, it varies, and mostly reversible. In the sense, even without medication, it becomes reversible if the immune system is very good to this particular individual, which is reversible in the respiratory pathway. It causes respiratory pathway obstruction based on the bronchial inflammatory reaction. In the sense, there has to be an inflammatory reaction for the asthma to occur, and this inflammatory reaction has to be at the bronchial level, and this inflammatory, it has to be in the respiratory pathway, causes respiratory pathway obstruction, and it is reversible, and it is variable. Factors are there in this, and it is divergent disease. So asthma is heterogeneous, multifactorial disease with variable and mostly reversible respiratory pathway obstruction based on the bronchial inflammatory reaction. Very concise definition. Some of the definitions are given, even the symptoms of this particular asthma, but this is the most concise and gives very specific, very clear and good definition which has been accepted internationally. And asthma is, again, you should differentiate from asthma from the obstructive lung diseases, especially COPDs and other things, by and large, because all the other conditions require, there is some amount of medication, some amount of treatment is required, but the asthma doesn't require always medication. Sometimes only when this condition is severe, probably you need medication, but otherwise it is quite reversible and with the treatment or without treatment. Coming to some of the causes or the reasons, the individuals who are more prone for this asthma, there are which are called as predisposing factors. The individuals who are more prone are the factors which can be from outside, which are called as extrinsic factors, factors within the body, which are called as intrinsic factors. When you say extrinsic factors, usually every one of us knows, mainly the dust. Everybody is allergic to dust. This directly related to the pollution. Then some people are allergic to some foods, some people are allergic to some medicines. As you all know, some people are allergic to penicillin, some people are allergic to NSAIDs, some people are allergic to some chemicals like even alcohol in the sense, spirit, and people, again, all these things are from outside. Pollen, which is most important thing, especially during winter, how the pollen, travels in the air and then the people gets affected and things like that. And like I said, chemicals, for example, paints. Some people are allergic to paints and some people are allergic to perfumes, their deodorants and things like that. They cannot take it. So these are all the external factors which causes this particular condition. And you see this more commonly in children and young adults because their immune system and the lung protective mechanism is not very well developed. Over a period of time, once it develops well, yes, absolutely there won't be any problem. And this is more common in children and this is less severe also. It is not that they'll get a severe attack and things like that. They will have some amount of difficulty in breathing, some amount of wheezing, cough, cold and running nose and things like that. But slowly it gets, or it weans off on its own, or maybe a little bit of medication is required. Bronchospasm definitely occurs, but it's within the exposure of the allergens, within few minutes it occurs. But then over a period of time, it gets slowly it weans off and things like that. There won't be any problem. Usually, these particular extrinsic factors causing asthma in the middle age or later age is little uncommon because good amount of immunity is developed. You are used to the environment, you are used to these particular chemicals, you are used to the dust, you are used to the medication. So when you are used to all these things, body already develops a protective mechanism. So having this in a middle age or later age groups because of dust or because of extrinsic factors is less common. That's what it indicates. Coming to the intrinsic factor, it is mainly because of the infection, which is the common cause. The infection in the lungs are the ones which triggers asthmatic attack. So this we have to be very careful. Your lungs should be clean and healthy. They should not get infected. The next is the psychological and physiological stress also plays a very important role, which is again inside. Psychological in the sense some people they get stressed out, they get anger, they start crying, and during the process there's a heavy breathing, and then they're triggering the entire respiratory system so that the cells or the elements in the cells in the respiratory system gets activated, and then there can be an attack which is similar to an asthma. Physiologically also you see, this is all psychological. Physiologically, for example, people are going exercising and too much lifting going to the on the staircase very soon and things like that. It is physics, but then there is some amount of exertion. Because of this exertion, there can be a difficulty in breathing, and there can be some amount of panting, which is similar to the asthma. And this is usually seen in case of adults. And attacks are little longer and severe, which have to be taken into consideration. When it is in the adults, these attacks are little longer and severe because it is not usual, this is not coming from the external, this is from the internal. So you have to take more precautions and more careful when there is an attack of asthma in the adults or in the later age. Long-term patients, in the sense patients who are having long-term asthma problem and things, they exhibit some amount of cough, sputum, and in between the episodes of this particular asthma. So you have to be clearly identify why they have this problem, clearly give medication for this particular thing, and then the dosage has to be formulated and regulated according to their episodes of this particular asthma, and according to taking the age into consideration and the weight of the body into consideration. These things have to be given and periodically, and a regular follow with a pulmonologist has to be there, and whenever they go to any doctor, to any other purpose, they should give that history that they have asthma and they are under treatment, and these are the medication what they are taking, and these are the intervals how they are getting and things like that. They have to reveal everything to the doctor, otherwise it's going to be little difficult, because the doctor has to know, and accordingly his treatment and his treatment plan varies as per the prevailing situation to this particular patient. As I said before, the asthma triggers, the triggering, there has to be something has to cause a stimulant. There has to be some amount of a triggering point where the bronchioles are triggered and the cells in the bronchioles are triggered, and then there is a chemical reaction happening there, and then the whole process of the series of events happens, and that's how the asthma occurs. Asthma is usually, as you see this particular slide, there is even asthma can occur, as I said before, because of the exercise, because of the pollen, because of bugs or insects at home. Then the chemical fumes, as I said, the chemical fumes also can cause cold air. Continuous subjecting the patient to the cold air can lead to some amount of disturbance in the lungs, and and can irritate the lungs, and a form of inflammatory reaction can be evoked by that, and then because of this cold air and humidification, excess humidification and other things, and because of the inflammation, it can trigger to an asthma. And as I said, fungus and spores, and especially if you have seen the recent episode of this virus and things like that, they also cause some amount of response to the respiratory system. And this is, I am talking about, this is about fungus, but virus also can cause disturbance to the respiratory system. And the dust, as you all know very well, everybody has a dust allergy, the excessive dust and things like that, then they will have this. Then smoking, some people are very allergic, even for passive smoking, they immediately get cough and they'll have the respiratory system will react immediately. Then strong odors, it is not just a paint, it's not just perfumes. Sometimes what will happen is even our own spirit, for example, or any of the hospital when they go for the cleaning, floor cleaning chemicals, and all those chemicals also can give a very pungent smell, where immediately once you breathe in that particular air, and it goes inside the lungs, and the bronchioles will get triggered, and then it may be a mild asthma, if not a severe asthmatic attack. And then the pollution, as I said, if you are staying somewhere close to any factories and things like that, you should be very, very careful, and where there is a lot of pollution in it, and then you have to be, either you have to wear mask, or you have to take protective mechanism, or you have to be very, very, very careful staying away such places and things like that. Anger also can cause, because during anger you speak fast, and there is a heavy breathing, and then there is it triggers the respiratory system, and which in turn causes difficulty in breathing, and slowly you might even have an asthmatic attack. And then likewise the same stress. If you are taking too much of stress, and then when you start breathing heavily, there is a hyperventilation. What will happen is you lose out a lot of oxygen, and there is a lot of carbon dioxide which is there inside, and then patient will have difficulty in breathing and things like that. And then pets also. From pets you might get some amount of these things, maybe bugs from the pets, or their hair, or their saliva, or whatever. From them also you are very much prone to get these particular attacks. So by and large, if you look at all these things, asthma can be triggered either from inside or outside. And the outside, most of these things are outside factors, what I mentioned. You have to be extremely careful with our extrinsic factors by taking precautions. And likewise now everybody is wearing mask. I think probably unless until there is no pollution, and unless until there is no much of not much of a problem, you should continue wearing mask, I feel, because that prevents a lot of external factors, especially this fumes, smoke, viruses, bacteria, probably at least to some extent. dust particles and then bugs, pollen, everything will be filtered. So you will at least get a clean air which you can breathe properly and things like that, because there is a 3-layer, 5-layer filtration, and then especially the N95 masks are doing phenomenal job. Probably with this, probably you will get some studies in later years with mask, without mask, what is the incidence of asthma, what is the incidence of COPD, what is the incidence of dust allergies and things like that. Probably over a period of time, probably in a couple of years, we will see a lot of articles coming on it. So all these things will be helpful for us. So we should continue at least for some more years and things like that. In case if the pollution level comes down, very well, fantastic, well and good. If the pollution levels, even if they are like this, I personally feel you should continue wearing mask, because at least your lungs are clear. They can take the clean air inside, and the probable chances of asthma is very less and things like that. So with this I said that the triggering factors, external factors are much more than the internal factors. So you should be more protective from the external factors. A simple wearing mask would be more advantageous. Coming to, there are different types of asthma. As you all know very well, a lot of the phenotypes of asthma, the allergic asthma, as I said before, everyone, at least 90% of the population would have undergone definitely this allergic asthmatic problems or conditions, where because of the dust, because of the pollution, because of working in the garden, working in the farms, working in the cattle, or working in the houses, anywhere, this particular allergic asthma everyone would have been experienced. This is one. Non-allergic, this is our intrinsic, in the sense the problems within the lungs, or maybe because of the infections in the lungs, or maybe because of some other reason within the lungs, there can be an asthma which has no relation to the external factors, which is called as intrinsic factors, which again is called as non-allergic asthma. You should differentiate whether it is having an intrinsic or extrinsic. Intrinsic is slightly severe, usually seen in the older age. Extrinsic is less severe, younger age group, and sometimes it goes off without even medication. Sometimes, no, most of the time it goes off even without medication. Whereas intrinsic, you need to see a pulmonologist, you need to see what is the condition of your lungs, you need to see why it has come, because of what are the intrinsic factors which are triggering asthma, and this needs treatment, and probably the dosage, the treatment modalities, everything will be explained better by the pulmonologist. Coming to the mixed asthma, that is intrinsic plus extrinsic, or intrinsic or extrinsic factors which causes asthma. There can be intrinsic factor, maybe mild inflammation of the infection in the lungs, maybe because of smoking, because of weather, because of some reason, and then the extrinsic added to that, it's very mild, but then added to some dust, pollution, pollen, or whatever other things, together they trigger an attack which patient will have an asthmatic attack. So this is called both combination, which is mixed asthma. Status asthmaticus is a severe form of asthma, which you have to take very seriously, and if such condition is there, you will have to go for treatment. Rest other treatments you can put aside, especially the dental treatments can be put aside. Status asthmatics to be treated in a serious manner compared to any of the other asthmas. Cough variant asthma, yes, this is a dry cough. Usually this particular patient, they will have dry cough. That's because of the irritation of the bronchioles and irritation of the bronchi. And because of this, maybe your exposure to the dust, or maybe because of exposure to the pollen, or for some reason there is irritation to this, and there is a constant cough. But as such, there is no great difficulty in breathing, but the patient will have continuously dry cough. There is no sputum in it because it is not infected, it is irritated. Coming to exercise-induced physical activity, yeah, some people, they do excess exercise. In the starting itself, initial phases itself, they start doing for hours together. No, you should never. You should train your lungs. It's not training only your body. You're training every system of the body, and you need to train even lungs for that. The capacity to inhale or exhale also to be trained. So you have to take it very slowly. You do it On the day 1, you do it only 20 minutes. For 1 week, you do only 20 minutes. After 1 week, you do for 30 minutes. After 3 weeks, you do for 40 minutes. After 1 month, you do it for 1 hour. Likewise, you increase gradual capacity of the lung capacity of inhaling and exhaling and things like that. The accommodation, the lungs also will take time to accommodate for this new physical activity. Likewise, if you do gradually increase, it's okay. But all of a sudden, if you start doing heavily, then the lungs cannot take it, and you start panting heavily, and then finally there will be a triggering of cells in the bronchioles, and then finally you might go into a little bit of mild asthmatic attack and things like that. Nocturnal asthma. Nocturnal asthma, this is the asthma which occurs usually during sleep. This could be because of too much of parafunctional activity of your, maybe some parafunctional activity, or very rarely maybe because of your obstructive sleep apnea, or maybe various reasons, patient getting disturbed sleep, and suddenly he'll get up and then start panting, and then he'll have little bit of difficulty in breathing and things like that. Maybe bad dream or whatever, all these things. So this is called as nocturnal asthma, which again you should consult a doctor, maybe along with pulmonologist. Maybe sometimes you may also have to go to psychiatrist to see why you are getting it at the night time. And then occupational asthma, which is rarely seen, but it can happen in any of these people who are working in chemical factories, especially the paints or the pharmaceutical companies, or who are giving pharmacy products in formulations and other things. If they are mixing and things like that, they are making new formulations because of those fumes or because of the chemicals, which they also might get these particular attacks, which mainly because of the occupational hazard, which is called as occupational asthma. These are the various types, but most commonly it is allergic asthma, non-allergic asthma, sometimes mixed asthma, and very rarely, not rarely, but quite rarely you see status asthmaticus. These are the 4 major variants which you can see, which may occur either because of the intrinsic or extrinsic factors, or combination of both the factors it can come. So you have to assess why there is an asthma to this particular patient when you are treating either for a dental problem or you are treating for any of the general condition.